Shiva. Well, briefly, yes, but in the other room. So very quickly, if they can tell us.
Okay, this is a 3-year-old child who was operated.
You're live now.
Yeah, this is a 3-year-old child who was operated for double outlet right ventricle pulmonary stenosis, left malpost great artery. The surgeon used a bovine pericardial hand-sewn conduit of 14 millimeter, and within about 6 months the distal conduit started showing severe stenosis. There was a progressive right heart enlargement, and what you are seeing, are you seeing the PowerPoint now?
Yes, and we're on the echo.
Okay, so this is the distal conduit stenosis with a peak gradient of 90 and the RV pressure was systemic. Next picture. We can see the RV dilated, tricuspid regurgitation, RV is poorly contracting with very severe right ventricular heart failure. Next. And this is the distal conduit narrowing. Next. So basically we have severe early degeneration of a bovine pericardial conduit resulting in severe conduit narrowing. Dr. Sri just started off this patient and she recorded against an aortic pressure of about 120. She had an RV pressure of 100. Yeah, you can tell Srija, what was the RA pressure?
RA mean was 13 millimeters of mercury.
So there was some heart failure, right atrial pressure was 13. On the distal pulmonary artery pressure was 25. There was a gradient of close to 80 millimeters from the right ventricle to the distal pulmonary artery. And is this the first angiogram? Okay, the first angiogram itself was an epicaudal.
Let's see.
And in this caudal projection, we have got a good delineation of the distal conduit stenosis, and you can see some measurements also on the sides. The narrowest portion is about 3.5 millimeter, and the length of the conduit what we need to stent may be something like about 15. And is there any other picture, Srija?
Next
picture.
just overlapping.
Yeah, so this is a cranial projection. However, this is completely there's a foreshortening of the entire conduit here. So we will be working on the caudal projection. Next picture. The child is on a conscious sedation with little bit of ketamine. Tell the intensivist to be around. Next picture. Yeah, so now
so the RV pressure was systemic or suprasystemic?
Oh, Shaka, what will you?
No, RV pressure was 100 millimeters of mercury against an aortic pressure of 130.
130.
Okay.
Shaq, can you hear me? I think we have lost audio.
Yes. No, we can hear you. You carry on.
Okay. So the plan was, basically this is a very small child, and so we are limited with the size of the femoral venous sheath that we can put in. The maximum probably we can go will be 8 French. And what we were thinking was again to use a Cook formula, 10 into 2, but then the 10 millimeter will be smaller. We wanted something like 12. So I was planning to break a 10 into 20 formula stent, expand it, take out the stent and mount it on a 12 millimeter into 2 centimeter balloon. What is the opinion? Like Oliver, you like it or?
Okay, so very quickly, Chetan, yeah, brief and quick.
Shiva, Chetan here.
Hi Chetan, how are you?
Quick question, because your valve looked quite, I'm good. Your valve looks quite good on the echocardiogram. Are you going to spare the valve?
No, we are going to be distal, yeah. Actually the valve is bit more proximal, Chetan.
We'll spare the valve.
So you're hoping to be distal. So what about, microphone, have we got one? Oliver, what about his idea of taking the stent off and putting it on a bigger balloon and deploying it that way?
Yeah, you can do that. The problem is if the balloon is too big, you may well be milked out of the branches.
Yeah.
So I think this, again, I would probably go for this tandem stent.
So double
stenting.
balloon
Yeah,
technique.
yeah.
Yep, okay.
I think that's a perfect case because you have a good distal vessel.
What was the RPA dimension? I've forgotten. Is it 12, 13?
It looks for 12, 13 millimeter. It's quite large. But Oliver, the problem will be the groin sheath
so
has to be
hopefully it
very
should not
big.
milk out.
Oliver, the problem will be the groin sheath has to be very big.
Yeah.
For the double.
How heavy is the child?
12.5 kg.
How heavy is the child?
The child
Yeah,
is
that should
10
be okay.
kilograms?
All right.
12
Yeah,
kilo.
I would go for, yeah, 9 flexor.
Yeah.
A 9 flexor will do it.
9 flexor with what are the balloon combination?
Okay, so you carry on.
So shall I?
Yeah, you carry on.
Shall I
Siva,
dislodge the
what your
formula?
plan is.
Come close.
Yeah, I think you have to.
Okay.
And you have to put it in on a bigger balloon.
Yeah. So what I was
The question was
thinking,
whether to put it on 2 balloons or a single big balloon.
originally was to use only 10 and
Sorry,
then
Siva.
yes, please.
Sorry. If you take the formula off and they're really nicely mounted, if you leave that orange covering sleeve on and just flare the one side, then it's easier to re-crimp it again.
All right.
Okay. Okay. That orange
Okay.
one, get it?
Good point.
I'll just see one fluoroscopy whether I have centrally mounted it. It's a Medtronic Admiral Extreme balloon.
Little legs.
Fluorostore that?
So this balloon will with a stent will go through a 7 or 8 French.
The actual
have
balloon will go through a 7 French, but now I am going through a 8.
Okay. So you've got an 8 French sheath up there.
Yeah. The only problem is it should not get milked out. The
Yeah.
about Chetan's point on sparing the valve, yeah, actually we are intending to spare the valve, but what the surgeon has also done is he has told me that he has given long pillars of the, when he created a bicuspid valve within the previous conduit, he has created long pillars, and that long pillars are actually getting fibrosed. So I don't know whether the two pericardial membranes that are used to create the two cusps are the culprit for this stenosis.
Oh, okay.
Oliver, I am not able to get the orange sleeve. It's larger in profile. What should I do?
Now it's too late. Now it's too late. Now I would just cut an 8 French short introducer.
Okay,
and
8 French
use
short
that
introducer.
to breach the valve of the Mullins.
See, actually, when you are handling
the
a formula,
orange
you are
sleeve,
completely
yeah, you
dependent
can
on Oliver for all the suggestions. Whatever he says, you have to follow. 8 French short sheath. Oliver is the
You
master
don't have
of
to follow everything he
But
tells you.
possibly we ask the other panel members what they would do in this case. Mark?
Put a thermo wire here.
Either that, or I would also use short Genesis stents mounted on whatever balloon.
1 balloon or 2?
I think 1 balloon would go.
One's enough?
Yeah,
Okay.
I mean, there's a bifurcation, but it's stretchable. Yeah.
Yeah.
Cut it off. Cut
cut-
it off. Cut.
Cut the
the
tube.
sheath.
Yeah, cut the
No,
diaphragm.
don't do that.
No. Just chop the,
Cut.
circumcise the tube.
Somebody was telling not to cut. Actually, I was trying to spare the sheath.
And you, and
Okay.
no, and use the foreskin.
Okay, get me a
You
dilator
would have
and just.
reused the sheath afterwards.
Right.
Since it is okay.
Since you have
Yeah.
8 French, my preference would be EV316 on the power flex, a short power flex 12 times 2, because it will give you 20 millimeter in the future and not 16 like the 535 formula. So my
Okay.
advance.
Formula also doesn't
Stent.
foreshorten Mark.
Okay, so you...
Just another,
Yeah, go on, Gianfranco.
just a comment. How long is the balloon
2 centimeter. The same
Shaft.
and the shaft of the balloon?
2 centimeter.
2 centimeter.
Is it longer than the sheath?
Longer
Or
the
were you
yeah.
asking about the length of the
No,
shaft?
of the old balloon catheter.
Yeah. So longer than the sheath or shorter?
Oh, sheath is very short. It's a small child. I have taken a small
Take into
sheath.
account the small sheath you cut. Otherwise,
Okay.
So now comes the challenges. So I'm trying to introduce into the valve. Yeah. Lot of resistance because an 8 is going through an 8.
I think that the white sheet is too deep into the valve.
Yeah,
if
it's
it's too
blocking.
deep, it will be shrunken by your blue sheet.
It's
You
not.
have to pull
It's
back a little bit
actually
the white sheet.
no. It was not very long, Mark. I just hardly entered. Okay, now I'm able to feel. I'm able to hold the stent. I'm pushing with my finger the stent, and it's going in. Yeah.
Okay.
Go to
Dilute.
that. No, no,
Let's
no.
hope it stays on the balloon then.
Undiluted.
Srija, come here. Sedate the
It
child a
stayed on the
little bit.
balloon.
Sister, conjure 5 milligram.
Little bit of sedation, please. Call the intensivist to be here. Okay. Go to the same caudal projection. It's 43 caudal. Shall I peel back, Srija? Sister, can you hold both this balloon and the wire together?
On an angio to check.
Yeah, I'll do an angio. Which is the contrast?
I think that was contrast.
It's contrast.
That was contrast.
Okay, I'm more distal. So I will come out. Are you on the same projection or?
Yeah. The child is
It's all
tilted.
distorted a bit, isn't it? With the
Yeah, yeah.
yeah.
Maybe because the wire has gone into the left and straightening the conduit towards the left.
Yeah.
Can you go to lateral view now?
Yep.
Dead lateral. Get it out.
Machine, yeah.
Here, currently, it looks as if it would cover, if inflated, the stent would cover the
little bit
origin
more elevo.
of the right pulmonary artery.
No, I'll see that check. I'm just looking at whether. See, I will come proximal.
Yeah. Yes.
I'm able to see the two pulmonary arteries getting separated here.
Enough fun.
Not too much.
You have to go in.
Okay, now I'll go in a little bit.
Yeah.
But you see
Bit
the
too
branching
far
has no, the branching has already started. Check. Come back to that view. Come back to. Show me the previous caudal.
Yeah, the other view is now
Previous
probably
caudal.
better, isn't it?
Previous caudal. Yeah. Show this. So here, give a little bit of elevo on this caudal, so that we elevo. Yeah, enough. Okay, I have a lot of room there.
Yeah, you've got way too far back.
That is one of the beauties of using tandem technique, that you really don't distort the anastomosis to only one lung, especially if you use super stiff wires.
Yeah. In bigger patients, I'm happy, Oliver, but in very
on the other
small
hand,
children,
crossing-
I want to use less of gadgets, but I will probably come to Birmingham and learn from you.
But on the other hand, I would try to save the valve and I wouldn't mind cross the right PA.
And
with the
go
other
into cells afterwards. Yeah, yeah. Okay. So at some stage you'll have to make a decision, Shiva,
Yeah, I'm almost.
because we've gone backwards, forwards, backwards.
I must say I always make my test injections with half of or 2/3 of the stent out of the sheet, so I always can recover it if I want to.
Yeah.
Yeah.
So what do you think now on that last angio?
Last angio, show, play it again. Hold this, hold this.
If we could replay it. Oh, not that one.
Yeah, this was the last.
So I think you've got to make a decision, and I think you're probably just about. I don't think you can go pull back anymore, and
Should be okay.
although you can go in a bit, but I think that looks fine. What do you
Yeah.
think, Oliver?
I would go for that, certainly. Yeah.
Further, but I
Mark?
should not.
I would look
Should
in
look
the
fine.
profile and try to avoid the valve. Yeah, you can. I wouldn't mind to be too far, but I would try
Yeah.
to save the valve.
Oliver, when Mark, I mentioned to you, see the
don't think
pericardial pillars that they have used within to create that valve, maybe the culprit for the stenosis itself, the distal end of the pericardial pillars that they have made, maybe that is where the fibrosis is there, and that is what is causing this, the leaflets to be stuck.
Yeah.
Shall we go to an RAO?
Shall we go adjust
So
the
I would.
position
I
like
think I
now?
would go for it, and even if you.
More RAO. More. Yeah. Okay.
The projection is changed.
Here we are centered on the stenosis.
Yeah.
I'll
Yeah.
go in. I'll
So
go in. here.
I think that's about right, and you'll have to take whatever.
Yeah.
You'll have to take whatever consequences appear after this, but
Yeah.
I think you're in good position.
This sheath is.
Sheath. Yeah. Just peel back. Fluoro. Any movement would have happened?
Mm. So now the stent's moved in a bit too much.
No.
Looks okay.
You see that?
Oh no, it's okay.
It's okay. So
And I still quite like the caudal projection, but you can do this.
sister, tell me the number. Does this child have a PFO or something? Okay.
Very good.
The heart rate is well maintained.
Yeah, and the pressure's okay.
The systemic pressures are okay. I'll give the pulmonary pressures, RV pressures now.
There's a lot of.
So if you could, we've got a couple of minutes with you, Shiva. If
Yeah.
you could just do angios in this, and especially in the caudal projection.
Yeah, sure. Get ready, pigtail, sister. We are taking out this balloon now. Yeah, the RV pressure is now much better. It's somewhere around 65. I'll take out the balloon.
Oh, look at that. Yeah.
Shall I just inflate to 14 atmospheres once and just get it even bit more dilated?
I think if you could do angios in 2 projections, even with the balloon there, that's fine. Oh, all right, that's inflate.
14? What is the burst of this? Okay.
Yeah. You ask after you inflate.
Yeah. Okay, sister, I want.
Well, it didn't burst, so you were okay.
Yeah. This is a Medtronic Invatec
So
balloon.
about a minute or so, Shiva. So
Pigtails.
if you could do the angios,
No,
Even
one
if the
minute.
balloon's
It's
there.
going.
if you do the angios.
Let the sheath go
Yeah,
inside,
yeah,
no
yeah.
problem.
Oh, all right.
Yeah. Fine.
Okay. Without the balloon, the RV pressure is
The
even
caudal.
lower.
Go to caudal.
Go to
Epicaudal.
caudal. Which is the caudal?
Stay
That's
caudal balloon.
up in the pulmonary artery, isn't it?
Just take out the balloon. You can take out the balloon.
Actually, I am proximal to the conduit. This is not, we have not gone deeper. I'll
Oh,
give,
yeah.
I'm proximal. I'll flush it now.
Yeah. So, can you do the angios, and
Can you
then we
take
might
out
have
this
to
balloon?
cut
Yeah,
away
it's
from
over.
you.
Just give a
Sister-
small amount of
sister,
contrast.
take out the
Can
balloon,
you
yeah.
just pour this into a... Okay. Yeah, steep caudal. Show me the
Cine?
projection. Yeah, Cine.
1 minute, not seeing.
Brilliant. Brilliant. Okay, Shiva, I think if you're not happy, then I'm going to beat you up. But that looks
No.
an excellent result, and I wouldn't do anything else
Yeah, sure.
with that.
Yeah.
Yeah?
I agree. We
Agreed.
yeah.
And don't even reinflate this one. Don't even think about that
Yeah, balloon is out check.
with a bigger balloon.
Yeah.
Okay, so well done. Once again, very educational, very interesting case. Congratulations to your team, Shiva.
Thank
So we'll cut away from you, okay?
Thank you very much. Thank you.
Right.
Show the kid.